Okay. So I'm going to knock on my door. Hi there, Mr. Logan. My name's Kylie. I'll be your nurse today. I'm just gonna wash my hands real fast and I'll do a quick assessment on you, okay? While I'm doing this, while I'm washing my hands, I just want to make sure I do a quick Q-sin. I'm going to check and make sure my bed was in the lower position, my side rails were up, he had his call light in his other hand, make sure there's nothing blocking the bed, any trip hazards. Wash my hands real fast. Make sure I had shut my curtain before I came in so I don't contaminate my hands again. All right. Hey there, Mr. Logan. I know you're feeling a little drowsy, but I just have a few questions for you, okay? Can you tell me your name and date of birth? And while he tells me his name and date of birth, I want to make sure I'm either checking his chart on the computer or looking at his wristband to make sure he's giving me the right information. All right, good. Which he can tell me his name and date of birth. Do you know what today is? Yep. Today is Friday. Do you know where you are at? Okay, no problem. You're at the hospital, okay? Your family brought you in. He knew his name, date of birth, what day it was, but was not sure where he was at, so he is alert and oriented ×2. I'm just going to do a quick assessment on you, if that's okay. I'm going to check for edema in his arms. No edema. I'm going to check his pulse real fast in both. Bilateral. Pulses are present. I'm going to have him squeeze my fingers. Can you squeeze my fingers real fast? Thank you. And can you push? Good. And pull. Excellent. Push and pull are positive. They are even, both right and left. I'm just going to listen to your lungs real fast, okay? Listen to his lungs real fast. Just make sure you take some nice, regular, deep breaths. Good. Okay, right here I'm going to go ahead and check your heart rate, okay? So here I'm going to check his apical pulse. I would check that for a whole minute. Okay, a minute went by. I got 87 for his apical pulse. And since I already have my stethoscope on, I'm going to go ahead and check his valves. I'm going to go ahead and listen to your valves. Make sure I start in the right lower quadrant and work my way up and then go towards my left and then work my way down. Okay, bowel sounds were present in all 4 quadrants. Excellent. While I'm here and have his gown up, I want to make sure there's no tubings or anything. He has no tubings, he has no Foley or anything. All right, I'm going to go down to his legs. Check for edema in his legs too. I'm also going to check for his pedal pulses. His pulses are present. Pulses, those are present too. I'm going to have him, can you push down? So, and pull up. Excellent. Do you have any numbing or tingling on your fingers or toes? Okay. I will know that he does have an IV in his right forearm from the ED, so I want to make sure I document that he has an IV already. I want to make sure that he is comfortable. Is there anything I can do for you right now? Do you need an extra blanket? Oh, make sure he has his call light in reach. Here's your call light. Make sure his side rails are up. Make sure he is good. All right. If there's anything I can do, if you can think of anything, just hit your call light, okay? Thank you. So exit my room, open the curtain. When documenting his head to toe assessment, I want to make sure that I document that he is alert and oriented ×2. Document that he knew his name, date of birth, and the day, but was not sure where he was at. Want to make sure document his lungs sound clear, his apical pulse, no edema in any extremities, no numbing or tingling. Bowel sounds were present in all 4 quadrants. He has that right. for our IV. Make sure I document that. He had no other kind of tubes or dressings. And then I will go and check my orders with the doctor and go on through my day. At the end of my day, I want to make sure I bring in the new nurse, do a bedside report. So I'm going to go grab my nurse, and we will go ahead and do a bedside report real fast. So exit. Make sure not on the door again. Hi there, Mr. Logan. How you feeling now after a long day? Good. Well, I'm leaving, so Kelly will be your nurse for tonight. I will do a quick report on you, if you're okay with that, right here beside you, so you can also hear. So Kelly, this is Mr. Logan. He's a 32-year-old male who was brought in today after his family found him down. He came in with decreased level of consciousness, rapid breathing, free deep breath. His family said for the last couple of days he's had flu-like symptoms. So we treated him for DKA. His labs were shown, his glucose was 804, his potassium was 6.1, his BUN was 39, pH was 7.12, his creatinine was 1.9, his CO2 was 30. He had few small respirations when he came in. He was positive for ketones in his urine. We started him on regular insulin through his IV. We did a round of 1 liter normal saline bolus, and then we did a continuous normal saline at 250. We did that for the 4 hours. Then we gave him another 1 liter normal saline bolus, and then we started him on D5.5 normal saline, continued his insulin. His glucose then was 174, so that definitely went down. We rechecked his BMPs. His potassium went down to 3.7 from that 6.1, so we started him on, we gave him 40 milliequivalents of potassium chloride, PO. 4 hours later, we repeated his ABGs, which looked a lot better. His pH was back to normal, 7.36. His CO2 and his HCO3 was back to normal. We discontinued his insulin IV, and we started him on sub-Q insulin. I've educated him on DKA and how to prevent it and some of the signs so he can get here sooner than when he did the last time. Do you have any questions? Good. Mr. Logan, do you have any questions? Good. I hope you have a good day. Before I leave my room, make sure I do a quick Houston once again. Make sure his bed's down, his side rail is up, claw legs in reach. Make sure he's good, doesn't need anything. All right, thank you. Wash my hands before I go out.